Good morning, everyone. I am Earl Francilia, and I will be reporting about the autoimmune disorders during pregnancy. So, autoimmune disorders are common among women, particularly pregnant women. The abnormal antibodies produced in autoimmune disorders can cross the placenta and can cause problems to the fetus. Pregnancy affects different autoimmune disorders in different ways. So, here are our list for autoimmune disorders. First is the antiphospholipid syndrome. Antiphospholipid syndrome, which causes blood clots to form too easily or excessively, can cause the following during pregnancy. So, one of its effects are miscarriage or stillbirth. Also, high blood pressure or preeclampsia, a type of high blood pressure that occurs during pregnancy, and also a fetus that may not grow as expected, or also known as small for gestational age. To diagnose antiphospholipid syndrome, the doctor may ask about any unexplained stillbirths or miscarriages, premature births, or problems with blood clots. And the doctor may also do blood tests to detect antiphospholipid antibodies on at least two separate occasions. Based on this information, doctors can diagnose antiphospholipid syndrome. If a woman has antiphospholipid syndrome, she is usually treated with anticoagulants and with low dose of aspirin during pregnancy and for 6 weeks after delivery. Such treatment can prevent blood clots and pregnancy complications from developing. And then second in our list is the immune thrombocytopenia, also known as ITP. So in immune thrombocytopenia, it is a complication which in which the mother has low number of platelets in the blood. It increases the risk of bleeding. So antibodies decreases the number of platelets, also called as thrombocytes, in the bloodstream. Platelets are cell-like particles that help in the clotting process. Too few platelets, or thrombocytopenia, can cause excessive bleeding in pregnant women and their babies. If not treated during pregnancy, immune thrombocytopenia tends to become more severe. The antibodies that cause the disorder may cross the placenta to the fetus. However, they rarely affect the platelet count in the fetus. The fetus can usually be delivered vaginally. So, how can you treat immune thrombocytopenia? So, first is corticosteroids. So, corticosteroids, usually prednisone, given by mouth, can increase the number or count of platelets and thus improve blood clotting in pregnant women with immune thrombocytopenia. However, this improvement lasts in only about half a woman. Also, prednisone increases the risk that the fetus will not grow as much as expected or will be born prematurely. Second treatment is, well, only sometimes the mother may be given immune globulin intravenously. So women who have a dangerously low platelet count may be given high doses of immune globulin intravenously shortly before delivery. Immune globulin, or the antibodies obtained from the blood of normal people with normal um, immune systems, temporarily increases the platelet count and improves blood clotting. As a result, labor can proceed safely and women can have a vaginal delivery without uncontrolled bleeding. So pregnant women are given platelet transfusion also only when the platelet count is so low that severe bleeding may occur, or sometimes when the cesarean delivery is needed. And also in rare occasions, when the platelet count remains dangerously low despite treatment, doctors remove the spleen, which normally traps and destroys all blood cells and platelets. The best time for this surgery is during the second trimester. And then third in our list of autoimmune disorders is the myasthenia gravis. So it causes muscle weakness. Its effects during pregnancy and between pregnancies vary between women. Pregnant women may have more episodes of weakness. Thus, they may need to take higher doses of medication such as neostigmine used to treat this disorder. These medications can have side effects such as abdominal pain, diarrhea, vomiting, and increased weakness. If these medications are ineffective, women may be given corticosteroids or medications that suppress the immune system, also known as immunosuppressants. Some medications that are commonly used during pregnancy, such as magnesium, can make the weakness caused by myasthenia gravis worse. So women who have myasthenia gravis must make sure their doctor know that they have it. And in very rare occasions, during labor, women who have myasthenia gravis need help with breathing or assisted ventilation. Although vaginal delivery is recommended, women may require assistance, for example, with forceps. The antibodies that cause this disorder can cross the placenta. Approximately 1 of 5 babies born to women with myasthenia gravis is born with the disorder. However, the resulting weakness of muscles in the baby is usually temporary because the antibodies from the mother gradually disappear and the baby does not produce antibodies of this type. And then fourth of the autoimmune disorders is the rheumatoid arthritis. So rheumatoid arthritis is an inflammatory arthritis in the joints, usually including those of the hands, the feet, are inflamed, resulting in swelling, pain, and often destruction of joints. So rheumatoid arthritis may develop during pregnancy or even more often shortly after delivery. If rheumatoid arthritis is present before pregnancy, it may temporarily subside during pregnancy. This disorder does not affect the fetus directly. However, if arthritis has damaged the hip joints or lower lumbar spine, delivery may be difficult for the woman, and cesarean delivery may be needed. The symptoms for rheumatoid arthritis may lessen during pregnancy, but they usually return to their original level after pregnancy. If a flare-up occurs during pregnancy, it is treated with prednisone, a corticosteroid. If prednisone is ineffective, a medication that suppresses the immune system or an immunosuppressant may be used. A flare-up after pregnancy can make it difficult for a woman with rheumatoid arthritis to take care of themselves and their infant. And last in our list is the systemic lupus erythematosus, also known as lupus. Lupus is a chronic systemic rheumatic disease that can involve joints, kidneys, skin, mucous membranes, and blood vessel walls. And then it may appear for the first time, worsen, or become less severe during pregnancy. How a pregnancy affects the course of lupus cannot be predicted, but the most common type of flare-up is immediately after delivery. Women who develop lupus often have a history of repeated miscarriages, fetuses that do not grow as much as expected, or small for gestational age, and preterm delivery. If women have complications due to lupus, such as kidney damage or high blood pressure, the risk of death for the fetus or newborn and for the woman is increased. So, the problems related to lupus can be minimized if the following are done. So, first, women wait to become pregnant until the disorder has been inactive for 6 months. Second, the medications have been adjusted to control lupus as well as possible. And lastly, blood pressure and kidney function are normal. So, in pregnant women, lupus antibodies may cross the placenta to the fetus. As a result, the fetus may have a very slow heart rate, anemia, a low platelet count, or a low white blood cell count. However, these antibodies gradually disappear over several weeks after the baby is born. and the problems they cause resolved except for the slow heart rate. If women with lupus were taking hydroxychloroquine before they become pregnant, they may take it thoroughly throughout pregnancy. If flare-ups occurs, women may need to take a low dose of prednisone, a, a corticosteroid, by mouth. Another corticosteroid such as methylprednisolone given intravenously, or a medication that suppresses the immune system, or an immunosuppressant such as azathioprine. And that's all. Thank you.